Now, I'd like to take some questions from members of the media, and so that they can hear you in north and south, we're going to ask you to walk up to the podium and give your questions.
Is good? You said the system was analyzed and it was found out to not be prepared for what's happening right now with the influx of people. Is that what we experienced over the weekend with the system shutting down, and is that expected to continue happening?
Well, I didn't say it wasn't prepared. I said it didn't have the capacity to handle this volume of claims. Now, Kimberly, can you address what happened over the weekend with the...
Over the weekend, we actually deployed additional code into our system to handle the $600 payment and some additional electronic code updates for electronic filing for employers and some other things for notices. So that's a typical deployment. When we deploy new code, we take the system down and we deploy that. So what everybody was experiencing on Saturday was typical when we deploy new code, that we have to pull the system down in order to do that. And we may see things as we go forward in order to operationalize some of these other components of the CARES Act. We may see that, but we will try our best to message out everything well in advance.
Just a follow-up. Is increasing the capacity of the system an option at the next Nevada legislation?
I can assure you we're going to be discussing the capacity of the system and the funding of DETR during the next legislative session. Thank you.
And now we'll go to the members of the media who are on the phone line. As a reminder, if you could keep your microphone muted until you're called upon. The first person I'd like to call upon is Michelle Price from the AP. Michelle, if you're on the line, please unmute yourself, and you should just be able to ask your question, and we should be able to hear you perfectly fine.
Governor, the governors of California, Oregon, and Washington announced a compact to coordinate their plans to reopen their states. I'm wondering if you were invited to join that pact, or will you try to join it, and if you would consider opening the casinos in Nevada when there's still hotspots or outbreaks anywhere in the U.S.
As I have stated, and I am well aware of the 3 states, so those governors are all friends of mine, and I see them on a regular basis. I communicated with Governor Newsom yesterday several times. I am going to base a decision when to ease any regulations or open up the state, as you put it, and provide some relief, however you want to deem that, based on the advice given to me by the medical team that I have put in place, based on the statistics that you're seeing in the daily situation report. We are not there yet. I don't know when we're going to be there, but we are working in concert. Those governors all have the same goals that I do, and I'm happy to work with anybody and everybody as it relates to the recovery as we come out of this pandemic.
Thank you, Michelle. We're going to take another question from here in Carson City.
A follow-up on that, do you have specific metrics in mind that you're going to be looking at, like Governor Newsom does?
Yeah, I do not have specific numbers. I mean, we make charts, you can see them. I get a daily slide deck every day that deals with the issues that are most important to me. Clearly, as we do more testing, and we plan to continue to do more testing, we're going to get more positives, because the positives are a direct correlation to the number of tests you do. The issue I have is the infection rate, the hospitalization, the intensive care hospitalization, and ultimately ventilator use and fatalities. Those are the issues that I'm looking at. This is not going to be a political decision for me as to when to open. I don't have an exact number. I'll take a lot of advice from our medical folks and determine what's in the best interest of keeping all Nevadans safe before we decide opening up. I certainly don't want to be premature and have to come back and say we went too fast. So we're going to take it slow and steady and listen to the doctors.
Have you gotten lobbied by trade groups and businesses urging you to open up the government soon?
I've gotten lobbied by a lot of people. I assure them, I give every one of them the same answer, that my number one focus is to protect the health and welfare of all Nevadans. And hopefully all these different special interest groups will share that same priority with me, and that's what I tell them.
Thank you. We're going to go back to the phone line. Todd from KTNV, if you are on the line at this time, if you could unmute your microphone, and we should be able to hear your question.
Yes. Hi, Governor. My question is about, we heard a lot about models when it comes to predicting people getting COVID-19, but I'm curious, are there any internal mechanisms that you guys have when it comes to unemployment claims? Is there any way for you guys to say, well, right now we're at 300,000, but we expect this number to begin to dwindle, or do you expect that number to continue to increase? Are there any indicators to let you know either way?
Well, I don't have a model as it relates to my unemployment claims. I can assure you that as every day I'm notified of more businesses that are temporarily shutting down or furloughing employees, and we have a healthy unemployment fund. And I can also assure you that once we start easing the restrictions, the number of claimants is going to go down. So we're just going to have to wait till the time is right based on medicine and science and not based on politics. And that's what I intend to do.
Thank you, Todd.
And I'm curious,
We'll allow a follow-up
if I
question,
may,
Todd. Go ahead.
I'm sorry, Governor, you talked about testing, so I'm just curious, what are your thoughts about President Trump today making it clear during his press briefing that he believes testing is up to the governors? If people need tests, the responsibility is for the governors to secure enough tests for people in their states.
Well, that's kind of been the place that Nevada's been in this entire time. We've had to secure all of our tests. We got, as I said previously, a few components for some tests, but we've been responsible for procuring all of our tests. We're continuing to do so, and we're upping that procurement as much as possible, and hopefully we'll be able to test more people. But it would be nice if we got more help, but I'm not counting on any.
Thank you, Todd. We're going to go back to questions here in the room in Carson City, and we'll be back to the phone lines in just a sec.
Hey, Governor, last week you guys, you and Dieter announced the new call center vendor that you guys had partnered with, 100 new employees to help with the unemployment claims by phone. Is there a reason why that company wasn't named? And when do you think we'll see a phone number for that company so that people have an increased capacity to be able to call in?
Kimberly, go ahead. This is my unemployment expert, so she's...
This week.
This week?
Yeah.
Okay, cool.
For sure.
And can I follow up with a separate question? When it comes to skilled nursing homes and other similar facilities, it's been 237 cases now in 32 of these facilities. What's the state doing to address these outbreaks in these facilities? Well, that's one of the reasons we activated more members of the National Guard to be able to get into these facilities. There are a lot of these facilities of varying sizes across the state. It's extremely unfortunate. My mom was in a rehab facility for a couple months a few years ago when she had a broken back situation, and the folks that are in there are more vulnerable, clearly, because they have underlying conditions, and we did make sure that we can get enough PPE into them and provide professional services. I know some of our battle-born medical team have been asked to go into some of these, and we're going to send more medical professionals, retired folks in there to try to provide some assistance, and it's a focus for all of us because those are our most vulnerable citizens. Thanks.
Thank you, Colton. Next, we'll go to Vanessa Murphy from KLAS. Vanessa, if you're on the line, could you please unmute your microphone and you can ask your question now.
Thank you, Governor Sisolak. Thanks for taking my question. We know, as you mentioned, PPE is an issue. We know that healthcare workers are concerned. We also know that most hospitals are not releasing the numbers of positive COVID-19 employees. Does that concern you?
Well, I have learned that I don't have a lot of control over the health districts in the state of Nevada. I would like more information. I'd like more timely information. They are responsible for that, and they're also responsible. You've got to understand, and I get on my staff, and again, I'm going to commend my staff. I mean, Michelle's walking out right now, but I've got the absolute greatest staff in the whole world. And I read this stuff. My mom will say, or my wife will see an article in the paper that this assisted living facility, the nurses are claiming that they don't have masks, or this one doesn't have gowns. And we do not provide it directly to those facilities. It comes up through the channels the same way it comes down through the channels for distribution. It's concerning to me that they are not getting enough. I don't know if the hospitals, I saw in the paper today that UMC they thought a 2-month supply of PPE. So that seems like, significant amount. I want to make sure that everybody on the front line gets that equipment as much as is possible. And I would like timely information. I know that with the media, some of you get frustrated, as do I, when you see the reports coming out at different times of the day versus the positives versus the hospitalizations versus the fatalities and whatnot. So a little more consistency in reporting from the health districts would be great.
Thank you, Vanessa. We'll go back to questions here in the room in Carson City.
Governor, you have a medical advisory committee to tell you when we're at the maximum or what the numbers mean. Do you have a committee, or are you considering or working on one that's going to help you open things up in a systematic way?
I will certainly seek out the advice of business experts. I've got a lot of internal folks with GoEd. As was previously asked, I have no shortage of business and interest groups volunteering information and suggestions along the way. I'm happy to listen to anybody, but I certainly don't want to be premature and give anybody the idea that that's in the next foreseeable couple immediate future, because it's not. We need to keep working to keep flattening the curve and keeping the hospitalizations down. But when we get to the point about talking about opening up and relaxing regulations, we will certainly seek input.
Thank you. And we'll go to Jacqueline Schultz from Fox 5. Jacqueline, if you're on the line, you can unmute your microphone and we'll be able to hear your question. Thank you.
That was an easy one, Jacqueline. Thank you.
We'll come back to the room in Carson City and we'll go back to the phone lines in just a second.
Governor, when do you anticipate we might need to call a special session?
I haven't had enough time to think about calling a special session. Right now, we've got things as best under control as we possibly can. I appreciate the legislative leadership who we're in contact with and keep them informed about what we're doing. You know, we're going through some budget situations. We're asking for preliminary numbers to come in. And if and when that time becomes appropriate, we'll certainly let you know. But right now, I don't have anything planned.
Where are we in the status of you getting from these agencies proposed cuts and acting upon those?
Well, we can't act upon them yet, but we're in the stage that I think they were supposed to be submitted this week. End of this week, we're supposed to be getting some preliminary numbers from our agencies, and I'm confident that they're going to meet that deadline.
Thank you, Michelle. We'll go back to the phone line here. Victor Jakes from the Las Vegas Review-Journal. If you're on the line, please unmute your microphone and you can ask your question.
Hey, Governor, two quick questions. One, do you anticipate schools reopening in May? And then my second question, if I could, last year the legislature passed a record state budget. Why didn't you include the needed fixes to the state's unemployment system?
Okay, the first one was, do I expect the schools to open up in May? Is that what?
Yeah.
Okay. I don't know. That'll depend on what our medical experts say in terms of where we're at on the curve and, how we can best address the situation. I mean, I'd like nothing better to get those kids all back in school, and I know the parents would like to get the kids all back in school, but our all focus is all the same on making it at the appropriate time, and that'll again be based on not what's convenient or what's political, but based on advice from my medical folks that are going to have to give me that information regarding where we stand on the curve and the risk of transmission in our schools at that point. The second one was about unemployment during the session. Is that?
Well, yeah, you talked about the state. The state's unemployment system had needed upgrades for years, and you inherited the system. I mean, last year the state passed a record state budget. I mean, was it an oversight to not upgrade the unemployment system then?
Well, I don't know if it was an oversight. You know as well as I do, Victor, you follow the legislature, and we put in requests, and the department makes requests, and the legislature sends us their determination, and that didn't get through. It was not funded the way we wanted it funded.
Thank you, Victor. We'll go back to questions in Carson City.
Hi, Governor. The Sentencing Commission met yesterday and advised the Pardons Board to convene itself and continue a discussion about letting inmates out early. As the chair of the Pardons Board, are you planning to take that recommendation?
I have a phone call scheduled with Justice Hardesty, who has spoken to me about this. We will have a meeting of the Pardons Board. I don't know when that's going to be. There are issues as it relates to those early releases that are of great concern to me. I want to do the right thing. At the same time, there needs to be a release plan. A lot of these people are still in there because they don't have a release plan. I don't want to put them out on the road, on the street with no place to go live. There's not real lot of job opportunities right now. You can see with the record unemployment claims that we're getting. And there's not necessarily even housing or food for these folks. So, and medical care. These are all situations that need to be thought through before you have a release of a whole bunch of folks. And I'll need a lot of answers, and I'm counting on the folks, Justice Hardesty and my Pardons Board fellow members, to come up with a plan. But I would assume he's going to recommend we get together in the next couple of weeks.
So you do plan to, as chair, call that meeting?
I plan if he requests me to call the meeting. I wasn't at the Sentencing Commission meeting. I don't know the dialogue. I saw that the vote, I think, was 10-8. I don't know what kind of dialogue was had, if it was what the issues were for the people that voted no, if they had the same issues. I'll wait to get a review from him and then determine whether or not it's appropriate to call one.
Thank you, Michelle. We're going to go back to the phone line for our last question before we wrap it up. I believe that Fox 5, Jacqueline, was still on mute. So Jacqueline, if you're still there, we'll give you a chance to unmute yourself and ask your question, and then the governor will give some closing remarks. Jacqueline, go ahead.
Thank you, Governor. Apologies for the disconnect earlier. My first question is there anything Dieter is doing to help the thousands who keep calling every day, who have called for 4 weeks straight and still cannot get someone on the phone? And then my second question is, a number of these gig workers as I heard, are not going to be able to get any funds till mid-May or early May, when the website can be updated. A lot of people and gig workers are pretty desperate right now for some funds. Is there any way to speed that process up for them?
So regarding the gig workers, pandemic unemployment assistance does not exist in our current structure. The state of Nevada has never managed disaster unemployment assistance, which is what this is modeled after. So we don't have a mechanism currently to do that. So we are working as rapidly as we can to get a methodology in place. So of course, as soon as we have it available, it will be up and we will announce it, whether it's 2 days or the first week of May. We will be announcing that immediately. And I'm sorry, I forgot the first part of your question.
It was, there are people who have called for 4 weeks straight who still cannot get someone on the phone, who are being directed to call on the phone. They have told us they have no more money. They have no more money for food. Is there anything being done to relieve the phone lines?
So as the governor stated, that we are hiring a call center of potentially as many as 100 agents to start, that we can start triaging through those calls. We are also communicating with people via email. We've received over 70,000 emails, so we're addressing those. So we're using every modality to try to reach people and return calls and contacts. We're using every method. So I appreciate the frustration, but we have been adding resources every single week since the start of the pandemic, and we continue to do so, and that's all we can continue to do at this point.
I just want to add there that since this pandemic began, we have tripled the size of the office by going from 70 to 200. Now we're increasing it again by 50% to go to 300 people, more than 300 people. Hopefully people will have as much patience. I understand the frustration. I understand that they're short on funds to buy groceries and various sorted items that they need, but it's not the fault of the people who are working at Dieter, who are going overboard to try to help everybody and get to everyone possible. But understand, when they get somebody on the phone, these calls often take 15 to 30 minutes, so you can't do that many in a day, somebody that's there. And when we've got 300 people working, and if every call takes 30 minutes and you can do, 12, 15 a day, it takes a while to get through this many people. So it's just a problem with the capacity of the system, and we will just, I implore you to be as patient as you possibly can, and we will try to get to everybody.
Thank you all. That's all the time the governor has for today. We'll do some closing remarks, and we'll be back soon to update you again.
Again, I want to thank everyone for tuning in to join us. We try to provide as timely of information as we can through both our own websites, my websites, the state's websites, the health response website, but through the local media partners. I mean, I don't consider the media our enemy. I'm telling you this again and again. It troubles me greatly when I see publications that are going out of business across the state. Some of the smaller communities have no one, and they rely on some of the online services, and it doesn't happen for free. If we don't support them, we're going to lose more outlets, and we're going to have less news being distributed. So please, if you can afford it, support your local news outlet, subscribe to a local newspaper, and we can assure everybody's going to have access to good quality information. That being said, I encourage you all, please, you're doing a great job. People are staying home. The curve is being flattened. I encourage you to continue. Now is not the time to let up. Please stay safe, stay healthy, and stay home for Nevada. Thank you all. God bless you.